going to start off today by telling you a story about a man named Nathan. Secondhand smoking took the life of Nathan. Nathan was a Native American and member of the Sioux tribe who never smoked a cigarette in his life. For 11 years, he worked at a casino and inhaled the smoke each and every day. This exposure to smoke caused him to develop serious allergies and problems with his lungs because of inhaling smoke on the day-to-day basis. Breathing in other people's smoke made his health so bad that he had to leave his job. Nathan used to be active and athletic. He was even a member of the Marine Corps. He loved to participate in tribal dances, and after getting sick, dancing just a few steps wore him out. Nathan hoped that sharing his story would help others understand how dangerous secondhand smoking truly is. Nathan's lung damage led to his death in October of 2013. He was only 54 years old. Some of the sources I used are shown up on the board. I have multiple sources from the Surgeon General, raising taxes, and so on. The problem I want to speak with you today is about how extremely dangerous smoking truly is. Smoking is not only harmful to ourselves, but to others around us. Smoking is a leading killer in the United States, and it seems that most people have turned a blind eye to this problem since the problem has decreased in recent years. There are many solutions to cutting down the size of the population who smokes. Smoking cigarettes comes with a variety of different diseases which lead to early death. The most prominent diseases are lung cancer, heart disease, and other diseases related to secondhand smoking. Smoking cigarettes is the single greatest cause of preventable deaths in the United States. The first one I want to talk to you about is lung cancer. 90% of lung cancer cases are related back to the individual smoking. This outrageous number shows a strong positive correlation of getting lung cancer if you smoke. If you think about it logically, smoking can do no good and it can only harm your body. You're directly inhaling more than 7,000 chemicals in each and every cigarette. Lung cancer begins in the lungs and can spread to the lymph nodes and other organs of the body, such as your brain. Why would you risk such a disease when you know that smoking makes you 15 to 30 times more likely to get lung cancer? Lung cancer is one of the more difficult and painful diseases to try to treat. It is not only extremely costly from a monetary standpoint, but to your family as well. 158,000 people died in 2015 from lung cancer related to smoking. We as a nation are doing better at educating our public and our children, but more needs to be done. And on the board you can see the differences between a healthy set of lungs and lungs that have gone through lung cancer. Heart disease is the second most prominent disease related to smoking cigarettes. The chemicals in cigarettes are much to blame for this. They directly harm your blood cells, which in turn damage the heart and structure of your blood vessels. Atherosclerosis is a disease when a waxy substance called plaque builds up in your arteries and makes it hard for the blood to pass by. This causes them to harden and narrow. This eventually leads to coronary heart disease, which can cause chest pain, heart failure, and even heart attacks. I want to reiterate that all of these diseases are completely preventable if you would give up the cigarettes. Secondhand smoke, which is what Nathan died of, is extremely dangerous as well. Just because you aren't the one putting the cigarette up to your mouth and smoking can cause death. Contrary to popular belief, there is no risk-free level of secondhand smoke. 2 out of 5 adults who don't smoke and half of children are exposed to secondhand smoke on a daily basis. About 7,300 people who never smoked die from lung cancer due to secondhand smoke every year. Since 1964, 2.5 million non-smokers have died because of this. This is extremely unfortunate for those innocent bystanders because they weren't the ones who were deciding to put the cigarette up to their mouth, and yet they were the ones getting sick and dying. We can prevent smoking and the deadly diseases that it comes with by asserting further action. Continued education is how we are going to do this. Continued education and action is needed to further combat the use of cigarettes in the United States. We need continued education because children and adolescents are at risk. Research shows that children are especially susceptible to smoking, and experimentation and initiation with more than 3,800 children smoking their first cigarette between the ages of 12 and 17. This amount of children experimenting with cigarettes is astounding. In fact, it is unethical to sit back and not do anything while our children are trying this. Some of the prevention methods that the Surgeon General lists on his website are being successful. Mass media campaigns, higher tobacco prices, smoke-free laws and policies, evidence-based school programs, and sustained community-wide efforts are all what we need to be doing. We need to continue to use mass media campaigns to reach out to the age of people who are trying cigarettes. Releasing media campaigns that target this age group is extremely helpful because they are already watching TV and will notice these ads. There was a study that showed for 4 years that students in one pair of communities received media interventions in school programs that had common educational objectives. The result? Significant reductions in reported smoking, along with consistent effects on targeted mediation variables, were observed for a media and school group. This just goes to prove that education combats the use of cigarettes. Raising tobacco prices will help the prevention of cigarette usage because they can't afford to easily buy them, and they will less likely to smoke if it's costing their pocket. Their money can be better spent elsewhere. Big cigarette companies know this fact as well. In fact, Philip Morris stated, "Tax increases are expected to continue to have an adverse effect on the impact of sales of tobacco products by our tobacco subsidiaries due to a lower consumption levels." So big tobacco companies are noticing this effect as well. We need to raise the taxes. Smoke-free laws and policies will further discourage the use of cigarettes. Anything that makes using the product harder will have an effect to discourage the behavior. The Center for Disease Control stated, "The primary purpose of smoke-free laws and policies is to protect non-smokers from secondhand smoke, and also the ones smoking themselves. However, smoke-free laws can also motivate and help tobacco users to quit and prevent use. Studies have shown that the implementation of smoke-free laws and policies can increase cessation and reduce smoking prevalence among workers and the general population. It may also reduce smoking initiation among youth." And this has been researched and is evidence in my citations. Evidence-based school programs are also extremely helpful in educating our children at school. Community-wide efforts also play into helping children and others to not smoke. At the follow-up assessment, I quote, "The smoking rates for adolescents in the intervention-educated community were 40% lower to the other reference community, which did not receive the intervention." So this is a lasting effort, and it shows that children and community members, when we gather together, are not smoking. A last effort to prevent horrible diseases associated with smoking are programs designed to help quit the smoking if you've already picked up the bad habit. There are countless options that can help you quit. The major websites like smokefree.gov, lung.org, and tobaccofree.org are just a few. They now have apps for your smartphone that can help track and keep you on track of achieving your goal to quit smoking. Communities offer programs where you can get involved and have a support system as you learn to quit as well. As you can see, smoking is extremely disease-ridden and is the #1 preventable activity that can prevent these diseases and deaths in the United States. Education and steps towards action are essential. Even though the smoking rates have lowered in the United States, we need to work towards a 0% smoking rate. Even one death by a cigarette is too many. Smoking cigarettes can cause many diseases and deaths. Education and preventative programs are essential to keeping our children and our other citizens safe from the effects of cigarette smoke. Let us all step up and take the challenge of educating one another on the effects of smoking. We must work together towards a smoke-free world, and it is the only way. Thank you.